We're talking breast cancer this morning, as we have really all month, as we work to help educate you about the disease during Breast Cancer Awareness Month. When faced with a diagnosis, a patient and her doctor will need to decide on a treatment option. Joining me now to discuss the different treatments that are available is Dr. Babita Jyoti with the Ackerman Cancer Center. Good morning, doctor. Thanks for being with us.
Good morning, Jen.
What does treatment for breast cancer generally look like? Because we do hear frequently about surgery.
So typically treatment for breast cancer involves some combination of surgery, radiation, and chemotherapy. It could be one of these, it could be two, or it could be all three. We usually make our recommendations based on, first of all, the stage or the extent of the disease. We look at prognostic features, which from the diagnostic biopsy, and ultimately we look at the final surgical pathology. But you're right, surgery is usually almost always a part of the treatment, and it's usually the first step in the course of the treatment. And this can be followed by chemotherapy and radiation. Surgery can be like a breast conserving surgery where you only have a portion of the breast tissue taken out. It's called a lumpectomy. And sometimes the entire breast tissue is taken out, and that's a mastectomy. And this usually is after surgery, we make our recommendations for chemotherapy and radiation after that.
And for a woman then who needs radiation, what are her options?
So for women who need radiation, and these are mostly all women who have lumpectomy require radiation, and some women even after a mastectomy need radiation. So we have the conventional radiation, which is also called X-ray therapy or photon therapy, and it's the most widely available form of radiation. In that, we have another advanced technique that we use called intensity modulated radiation therapy, which is a very advanced form of delivering this radiation. But in Jacksonville, we're really fortunate that in addition to conventional radiation, we also have a specialized form of treatment called proton therapy.
And can you explain what makes proton therapy unique? And in addition to that, you know, what kind of breast cancer patient would be best to receive proton therapy?
Yeah, so you use the right word. It is unique. Proton therapy is very unique. It's a very effective form of radiation. It's unique because of its physical properties, but also it's not very widely available. There are only about 34 centers in the United States that are currently treating with proton therapy. And Jacksonville is, like I said, fortunate to have one of them. Because of the unique properties of protons, we are able to deliver a very targeted and a very focused, precise treatment, radiation treatment.
And it's women who have certain forms of breast cancer, or those who maybe have been previously treated with chemotherapy.
That's right. So women who have breast cancer, so we use proton therapy for a lot of treatments, but especially for breast cancer, and especially in women who have left-sided breast cancer, the ability to stop that proton beam, unlike X-rays, which go through and through a patient, proton therapy, we have the ability to stop it where we want to, so at a predetermined depth within the patient, and we are able to stop as the beam goes through the breast tissue and the chest wall, which is the area we're treating. We're able to stop the beam right after that before it hits the heart or the lungs. So in a way, it's very protective to the heart and the lungs, and it helps these women live long, cancer-free and healthy lives.
And which is what we want to certainly hear. Thank you, Dr. Jyoti, for joining us this morning. Appreciate it.
Thank you.